Good afternoon, everybody, and thank you for being here. And I'd like to thank Walter for the kind words as way of introduction. I'm excited to be here today, and my plan is to outline two industries, gaming and healthcare, which are growing independently, but have an opportunity to combine their capabilities and skill sets to enable people to live healthier lives. I hope this dialogue is able to facilitate conversations. I hope that we are able to inspire new approaches. And most importantly, I hope this spurs new collaborations that will enable games to actually change health. As part of our conversation, what I plan to do is I plan to talk a little bit about UHG and Optum Labs so everybody knows the perspective that I bring to the table. I also want to talk a little bit about the 2020 year in review for digital therapeutics, the year in review for virtual reality, as well as the year in review for gaming. Beyond that, I want to talk about player engagement research. I want to discuss a little bit about realizing the potential of games and gameplay, the value it might bring to healthcare. And then I'm going to address that comment or that statement that games might change health. Optum Labs. Our purpose is to identify, develop, and deploy disease interception strategies to substantially improve health around the globe. We are inventing the future of healthcare by pushing beyond the best care out there to achieve the best care possible for our members, our customers, and our society. We currently serve more than 142 million individuals worldwide, and with 330,000 employees, we have 125,000 clinicians and 30,000 technologists. So as you might expect, we have the team and we have the capabilities to really realize the goals that I'm going to discuss today. Our vision is that we want to have a healthcare system that is equitable, integrated, personalized, and affordable for everyone. When we think about the future of healthcare, our vision is a system that is personalized, is convenient, and is affordable. One that helps people set and achieve their health goals. A learning environment where data and science continuously and rapidly improves standards of care. A consumer experience that is truly seamless, integrated, and effortless for individuals. And I think it's important to highlight that consumer experience is where we see value in how games can change healthcare. An environment that optimizes clinical expertise by getting people the right care whenever they need it and wherever they are. No unnecessary interim steps, no delays, and no friction. An infrastructure that is efficient, a workforce with diverse clinical and non-clinical skills, a collaboration capacity that brings together uncommon partners to accelerate innovation. This is why I'm excited to be joining this conversation today, and I look forward to the discussion in the Q&A afterwards, which everybody will note that there will be a link in the chat that will lead to the Q&A afterwards. For many reasons, 2020 had the feel of a seminal year in the use of digital tools and technologies in healthcare. What we realized is that the FDA granted marketing authorization to EndeavorRx for Akili Interactive, which is a ADHD treatment. Teladoc reported that there were 10.6 million total visits for 2020, an increase of 156% year over year. FDA issued guidance to expand the availability of digital therapeutics for psychiatric disorders. The FDA established the Digital Health Center of Excellence to accelerate digital health. The FDA granted authorization for Somrest. The FDA granted de novo clearance to Mahana Therapeutics DTX for IBS. And there was an increased emphasis on mental health from Wobot, Ellipsis, Mindstrong, and many, many others. With the increased adoption and increased clearance, it is reasonable to ask which technologies will be next to have their seminal moment in healthcare. Virtual reality is a technology that has traditionally been used for gaming and entertainment applications. It has realized consistent growth, and more people and more companies are finding new healthcare use cases. Among those are behavior, and they've partnered with Hoag Memorial Hospital to launch Nurture VR. Applied VR received FDA breakthrough device designation in 2020 to treat pain. HP launched the Reverb G2 Omnicept HMD. Facebook launched the Oculus Quest 2 HMD. Rec Room surpassed 1 million monthly active VR users. The number of monthly connected headsets on Steam reached 2 million for the first time in 2020, and average VR session playing time in 2020 was 32 minutes, which represented a 30% increase year over year. Additionally, what we saw with usage patterns is that we saw more weekday usage and weekday engagement with VR headsets than we had previously seen in other years. Weekend use increased, but weekday use increased much greater. And then yesterday I saw a report that VR was the fastest growing media market in 2020, representing an increase of great percentage. Digital therapeutics and VR were not the only industries that realized growth in 2020. We know that global gaming had a great year in 2020 as well. Gaming revenue is reported to be $180 billion in 2020. Growth in revenue from 2019 to 2020 was 20%. There was an increase in console gaming revenue of 19.8%. We saw PC gaming revenue increase 11%. And importantly, we saw mobile gaming revenue increase 24%. Among those surveyed, 79% of respondents said they had played games during a 6-month period in 2020. Additionally, those respondents indicated that their gameplay increased from 12 to 14 hours weekly. You might be wondering why I've invested time in outlining market growth for both of these industries. I did so because I want each of you to imagine if these two growing industries could combine their capabilities for good, what's possible? And if we combine those skill sets and capabilities, we can ensure that games will change health. If healthcare can leverage the amazing engagement that games realize, and if healthcare can help define the valuable data assets and the uses from player-generated data, there are limitless possibilities for us to combine, collaborate, and change health. Engagement. Engagement seems to be a constant conversation for everybody in the healthcare industry, from wellness providers to primary care providers to specialists. We all want to ensure that our patients and our members engage in care and activities that are best for them. It is that constant topic of discussion that leads me to identify what are the things about player engagement and gameplay that we should be replicating or utilizing to translate that into healthcare. One of the things that has recently been published in player engagement research is that in games that have in-game purchases, those purchases increase with more rounds or levels played. That's a very logical conclusion there. We also see that in games that have ads, that click-through rates increase with more rounds played. More exposure, more participation equals greater engagement. Obviously, there's something bringing those individuals back to play more rounds and to engage in more gameplay. In games that have neither in-game purchases or in-game ads, there more rounds increase revenue because those games are seeing an increase in revenue as a result of upgrading to premium versions or willingness to purchase the next version or the next title in the series. So additionally, what we've seen is that there are different engagement types. We have high engagers, we have medium engagers, and we have low engagers. Those individuals all respond differently. One of the challenges in healthcare is that we try to convince everybody that we are all equal and that everybody is equally interested in their health and that they'll engage accordingly because they value their health. This is evidence that we need to think about that differently within the healthcare space. We know that different engagement types have different motivators, and that's been demonstrated in gameplay. There are individuals who want to have achievements, and so they want to level up. They want to continue to seek new levels. There are other individuals who want to be presented challenges, and those challenges can allow them to unlock new capabilities or new levels. Those challenges have an impact. What has been demonstrated in the research is that personalizing that engagement state with the rounder levels leads to an increase of 4 to 8% in gameplay. Imagine if we increased patient and member engagement by 4 to 8% with their health and with the activities that would be good for their health, whether they be lifestyle or therapeutic specific adherence characteristics. One of the interesting findings in this engagement research is that challenges increased engagement in low and medium engagers, but it did not increase engagement with high. And so putting challenges in place actually had a detrimental effect for highly engaged people. Again, lessons for us to learn as we think about patients and members and how we want them to engage with their health, but utilizing these skills and these capabilities both throughout the healthcare system, but very specifically in digital therapies. So as we think about this, we want to find solutions which will increase patient adherence with their therapies. We want to support individuals to initiate and sustain positive health behaviors. And we want to create earlier opportunities for people to engage with providers before their conditions worsen, or there are late stages or little likelihood that we'll see positive outcomes from their behavior change or for their lifestyle choices. If we can enhance patient engagement, we know that we're going to realize these goals to improve health. Now, we know that user engagement is essential for digital health tools to realize their full potential, the therapeutic potential, and the financial value. For example, we can use sound design principles to impact health. And so this is actually one of the key things that I want to note in this conversation is the value of us to realize the potential of games and gameplay in healthcare. One of the things that games do well and that we would be wise to replicate is that games find an ideal balance through the use of micro, primary, and long-term challenges that we could apply these tactics to health. And so balancing challenges and mastery is going to be really important for us. As many people know who play games, rewards are constant. Games are fantastic at providing regular reinforcement or regular rewards. They are good at providing action-based rewards. If you complete an activity, they'll provide you a reward. Games are also really good at providing random rewards, as well as providing Easter eggs. Only the most dedicated people will find those rewards. Imagine if we translate that into healthcare and lifestyle behaviors. With digital tools, we have the ability to do that. Additionally, we have the ability to impact choices and how people make choices using digital tools. And so if we can translate that into healthcare, where people can understand that they have inconsequential choices, which won't have any impact on their health, they'll have necessary and important decisions that will have very significant impacts on their health. And then there are key or critical that will influence not only their life, but their future health. And so if we think about embracing these engagement approaches and these sound user design characteristics in games, we can change health. And it's going to be important for us to partner with people in the gaming industry and people in the digital industry that understand this to allow us to move forward. Additionally, recreating chance and uncertainty, which can build skills for people to be successful at health-related actions, is another good design principle that we should be following. Not necessarily more importantly, but also equally important is storytelling. Can we create personalized worlds that are interactive and will respond to the patient's actions? Can we allow people in digital worlds or in game worlds to design their own story, to tell their own health story, and to realize what happens as a result of those activities or actions that happens within that. Additionally, good user design enables social interactions. Can we enable patients to commune? Can we enable patients or members to compete? And then can we enable those patients to tell their stories? And so can we create a community? Can we create a social environment where all of these activities are facilitated? Gameplay and games provide us an opportunity to do that. Lastly, aesthetics. The virtual worlds that we're able to realize and the virtual worlds that we see every day, we see these really fantastic graphics, which are combined with music and other design features that enhance and improve engagement. Using those gameplays is really important. What do we bring in healthcare? What's our side of the coin in healthcare? Well, we bring data-driven feedback. And importantly for us is to outline who are the stakeholders in the healthcare ecosystem that really need data, and they need they need data to drive decision-making is what I should say there. And so we have the patient who needs data to drive their behavior. We need caregivers to receive data to understand their patients or their loved ones' health, understand how their health is changing and what actions can be taken. Systems and providers need to identify that as well as learning organizations like Optum Labs. And so there are countless volumes of data being generated by players. There is nothing more valuable than that data that's being generated. It's important for us in the healthcare system to identify the data sources which can provide value to stakeholders throughout the healthcare ecosystem. And currently that is an unrealized opportunity. What we know is that throughout an individual's life, they have periods of optimal health and less optimal health. So what we want to know is, can game data fulfill these tasks along the health continuum? And we know that people go from optimal health to disease and disability. We also know that healthcare should support and enable people who are in an optimal health and continue to help them optimize their health, as well as be able to treat them and otherwise manage their disease so that we can constantly and continually push them to greater health. The data sources that come from gameplay can help us monitor people's health, can help us identify when there's meaningful change or a delta that's important. It can help us deliver interventions. It can help us deliver multiple treatments and certainly multimodal treatments. And additionally, it can help us titrate that. So the critical role which game data fulfill is enabling this monitoring, identification, intervention, treatment, and titration of therapies. Those of us in healthcare can help game developers identify the data sources which can be used as important signals of health all along this continuum. So I return in my last slide to talk about games might change health, and I am very hopeful that games will change health. Can games increase equitable, integrated, personalized, and affordable care for everyone? I believe that that's possible. And so I think if we fulfill this mission and we fulfill the delivery of engaging content and we partner with experts in game design and game development, and we bring our data expertise to the table, we have the chance to change health. If we are able to combine and collaborate as two industries so that we enhance engagement as well as we enhance the utilization of gameplay data and identify new diagnostic, new identification, new monitoring capabilities from the data streams that come off of gameplay, we can change health. With that, I'd like to remind everybody that I will meet you in the Q&A after this. Please see the link in the live chat and join me for those sessions. Otherwise, I thank you for your time today. It's been my pleasure to be here, and I look forward to interacting with all of you. Have a great day.